So once you're in labor and you presented yourself to labor and delivery, the next step is to find out whether you're really in labor or not. And so what they'll do is they'll put you in a room. Some hospitals in some situations will put you in your regular labor room. Other places have what they call a triage area, which would be a smaller room where they can assess you to see if you're in labor. And they'll do several things. They'll put the baby on the monitor, which is a thing that goes on your tummy. There'll be one to listen to the baby's heartbeat. There'll be another little round thing that goes on your tummy that'll monitor your contractions. They'll have you get undressed, and they'll check your cervix, which means the nurse will take 2 fingers and put it in your vagina and feel your cervix to see how dilated you are. And typically they'll watch you for a while. They'll see how the baby looks, make sure the baby looks okay, and they'll see if your cervix is changing over time. Now sometimes it's very obvious when you first come in. If you show up at 8 centimeters, they're not going to need to do anything. They know you're in labor. However, if many times it's kind of a judgment call. And so sometimes they'll monitor the baby, make sure everything's okay, and the nurses will have you walk for a while, and then they'll recheck you and see if your cervix has changed over time. They also might assess you to see if your bag of water broke, and there's several ways to do that. One is to put a speculum, like when you get a pap smear in, and they can see the water. A microscope slide can be made, and that can be looked under the microscope to confirm that it's your bag of water. Or they can also do tests either with a Q-tip or with a little strip that changes colors, or they can do other chemical analysis to see if what's coming out is really your bag of water. So those are the kind of things that they're going to do to see whether or not you're really in labor and whether you need to stay in the hospital. Many times people come in thinking they're in labor and it turns out to be false labor, or maybe they think their bag of water broke, but it really isn't their bag of water. And in that case, you'll be sent home. Don't be discouraged. That's very common, and it's much better to come in and make sure you don't have a problem than to sit at home with a problem and not be checked. I can tell you in my own experience with our second kid, I brought my wife into the hospital thinking she was labor, and we got sent home. So it happened to me, it can happen to you. So if that happens, don't be discouraged or be embarrassed. Very normal. We'd prefer for you to come in if you're worried and be checked out. Now, if you are in labor, at that point, they'll be admitting you as an inpatient, and either, if you're in the triage unit, move you to another room, or they'll sort of let you set up in that room, and that'll be your home. So that's the first step, is to find out whether or not you're in labor. And usually, the nurse will be in telephone communication with the doctor, who will ultimately make the decision based on what the nurse is telling him.